Before we get into people's comments, Q&A, and please feel free to ask whatever. And you don't necessarily have to, get into a conversation with Dr. Song, but you could ask general questions as well. And other people on participating, feel free to try to address some of these too. We want it to be more like an informal discussion. I just wanted to put up a couple of slides. I had it at the beginning, and I think I can do it now. And then we'll get right into it. This will be like a few minutes. We'll get right into the Q&A. Just to put a little bit of context on what Paul was saying, when he talked about some of the disparities in the funding, medi-cal and stuff like that, on the top left-hand corner of these little illustrations, this kind of shows what's happened at Pacifica, okay, at the Sakura ICF. It says here, high cost and reimbursement rates discriminate. Your mom has medi-cal, I see. Now, I'm so sorry, we just have no more beds available. I've heard that personally myself when I told a facility that, I had medi-cal, my stepdad had medi-cal, so I don't do that. I haven't done that. What happens is that if you are a facility and you're going to get back $240 only for medi-cal patients, and you're going to get back $625 or more for Medicare, who do you think you would try to get rid of? Medi-cal, right? Does that mean that you are, a racist? Does that mean that you're spreading, racist practices? Well, objectively, in a way, you are. That may not be your intent, but the discrimination is in the numbers. It's in the numbers. There's no one saying be mean to people of color. It's in the numbers. Let's move over a little bit on the right-hand side, where it says the lack of bilingual, bicultural capacity and training. Here you see two little examples. It's going on currently. On the left-hand side, you see a psychiatrist sitting down, and there's a person, Asian person, in broken English and Vietnamese. He says, "My mom hit us from the bombings each day. She hated the soldiers and it rubbed off on us. I had to be a good model Asian student, even with our anger at the US." And this is a person who obviously has a lot of history and possibly some emotional problems, but you can see here that the psychiatrist, well-meaning person, has a hard time, may have a hard time trying to help out this person. And then right on the right-hand side, you see another example where a young African-American guy says, "Hey, my dad's side has sickle cell anemia. What do you think my symptoms indicate?" And the doctor regretfully is thinking, thought bubble, sickle cell, I heard like 15 minutes at my medical school. Down on the lower left-hand side, funding to research illnesses. This is a whole big area. Just one example that I will provide. Sickle cell anemia, there's 100,000 patients in the United States. There's 2.5 million people that carry the trait. However, cystic fibrosis gets 11 times more funding, 11 times, with 35,000 patients. It's a much, and I'll let you guess the racial breakdown of the patients here. Okay, and then on the very right bottom hand corner, in the last 20 to 30 years, hospitals and nursing homes, this is what they've been doing. They went on a binge to increase profit. And what they've done is automation, just-in-time lean production. They eliminated, certain workers they trained to be interchangeable so that, even if one's absent, you can use another one. Like a nurse is a nurse is a nurse, or a doctor is a doctor is a doctor, So use all of them. And they borrowed these techniques from Ford Motor Company, all the automakers and manufacturing. And some of the computerized assessment programs, electronic medical records, they eliminated some jobs, okay? And just-in-time and lean production, medical supplies and inventory, just for immediate service only. If you have too many, you're going to lose money. Equipment like hyperbaric chamber for burns, very costly. They don't have enough return on investment. Why don't we eliminate as many as possible? Epidemiologists, their salaries are very high. Why don't we just keep just enough to get by? Okay, this is before the horrible fires in California started happening, that some people need hyperbaric chambers. This is before COVID, where everyone needs epidemiologists. So these are the types of things that they did in order to cut costs and become more lean in US hospitals for 30 years. And they did not anticipate that this would result in discrimination going on steroids, but it did. So a lot of the discrimination that we face is based on technical improvements that at the beginning were not really intended to turn out to be racist, but that's the impact that it's had. So I think this is what's called systemic racism, because it's kind of like no one's intending it, but it's very much involved into the DNA of the numbers of our healthcare system. So I just wanted to add that as a layer to put onto the big overall picture that Paul provided. And welcome your comments, questions, and whatever else, things that you want to convey.